for joining us on this Monday. Today, Orange County Mayor Jerry Demings will discuss Tropical Storm Isaias and the county's preparations and its success. Of course, we will discuss COVID-19 cases, the goals for the week, strike team information, and many more details. Orlando Mayor Buddy Dyer is also here to discuss what is taking place in the city of Orlando. Dr. Raul Pino from the Florida Department of Health in Orange County also has information on testing numbers, testing timeframes, and other important data. Thank you so much, Mayor Demings.
All right. Good afternoon to all of you. Earlier today, we kicked off our unveiling of a Lynx bus, our Safer, Stronger Together tagline. So I'm going to take this mask off just temporarily here while we do start our press conference this afternoon. Let me just begin by giving you a bit of an update regarding the tropical storm Isaias. I'm close, I know. But we were spared this weekend. We're all thankful for that, that it didn't make landfall. But I will tell you that from an Orange County government perspective, our staff was truly ready. We were ready for whatever may have come our way. So it was a great dress rehearsal for us. We still got a few months to get through our hurricane season. We opened no shelters, and there was no damage here within Orange County whatsoever. So let me just say thank you to my staff for getting ready. I'm proud to say that we prepared our community. We distributed nearly 61,000 sandbags, over 300,000 face masks, and over 6,000 bottles of hand sanitizer within a 16-day period of time as we were going up towards the hurricane itself. So as the storm moves, we hope that the Carolinas and the other East Coast areas have a similar experience to us, that the storm only impacts them in a minimal way. It has been over 5 months since we have been dealing with the coronavirus pandemic, and each week we endeavor to start the week by telling you what our goals are for the week. And so I want to do that today. Today, the 3rd of August, and who would have thought we would have still been dealing with the COVID-19 pandemic in August. You know, a few months ago, we thought maybe the summer months would bring us a different experience. It would be hot, the virus wouldn't be here, but now we know that it has lived with us through the winter, the spring, and now into the summer, and it will likely live with us into the fall and perhaps begin in the winter again. So let me just share the goals for this week. First, we want to continue to make sure that our residents know where there is testing available here within Orange County. We want to ensure that people who desire to be tested have the ability to do so. And we will continue to also gain compliance from the various businesses that we have gone in to make certain that they're following the various orders that we have put in place. And we want to make certain that our residents have adequate access to personal protective equipment. Orange County has nearly 30,000 COVID-19 cases within our county. Here we are, just a few days into August. Going back to June the 1st, we had approximately 3,000 cases. So we now have 10 times the number of cases within a 2-month period of time. When we look at the day-over-day increases, there's something to, I guess, show promise for us. Within the last 24 hours, we had 224 cases. While we want to be excited about that number, it's a low number, relatively speaking. Just to put it in perspective, on Sunday we had an increase of 239 cases, Saturday an increase of 448 cases, Friday 417, and those numbers therefore are trending in the right direction. Although, quite honestly, we didn't have as much testing over the weekend because of the impending storm. There were 239 Orange County residents who have died as a result of the COVID-19. That is an increase of 5 just from yesterday, so 239 cases here within Orange County. We have tested nearly 260,000 people within our county, and we have an overall positivity rate, according to the state, of 11.6%. The statewide positivity rate is 13.09%, so we're doing better than the state at large. We will begin testing tomorrow at the Econ Soccer Complex in East Orange County, beginning at 8 a.m. to 1 p.m., and we will remain at that location through Friday of this week. We are asking individuals to register for appointments. The Orange County Convention Center will also reopen tomorrow, which is the state location. It is slated to open at 9 a.m. Organizers ask that after you pre-register that you print out your voucher to help expedite the process when you arrive on site at the various testing locations. I want to also mention some other partners here within the community who are providing testing. Walmart will be doing mobile testing, CVS, CareSpot Urgent Care, Guidewell Emergency Doctors, Passport Health, and Advent Health Central Cares are all doing testing here within our community. You will be able to check for the various locations by going to our website at ocfl.net/coronavirus. I'll talk now about our strike teams that we have put out to try to gain compliance again. To date, at least by midday today, our strike teams or compliance teams have been to over 400 different locations. They tell me they are getting a tremendous response from business owners and are leaving plenty of educational material behind after one of their visits. Right now, our portal is closed for the CARES Act monies for small businesses. That is because we're expanding the program to include micro grants to home-based businesses with 3 or less employees. Those grants will range from $1,000 to $3,000. We will reopen the business portal 1 week from today, 8 a.m. on August the 10th. We're still looking into the potential that we'll reopen soon the individual and family assistance portal. I do have some staff members who are here today who may be able to answer questions about either the business or the individual or family crisis assistance. But so far, we have provided approximately $50 million combined to individuals, families, and businesses here through the CARES Act funding within Orange County. In terms of evictions, since the pandemic hit Florida, Governor DeSantis put an order in place calling for a moratorium on evictions. I know that all of you are aware of that. And the governor's last extension of that order is somewhat different from the prior order. Landlords can move forward at this time with evictions that are non-COVID related. So as of today, there are some landlords who are filing various paperwork with the courts to proceed with evictions that are non-COVID related. The Orange County Eviction Diversion Program is being developed as we speak, and it is our goal to present the plan to the Orange County Board of County Commissioners during the regular board meeting on August the 11th. So at that time, we will unveil a program that for eviction diversion here within Orange County. So those details, again, are being worked out. And in terms of taking safety precautions, we do invite our consumers to support the effort that I talked about earlier, the Safer, Stronger Together tagline that we're putting in place to really increase the number of individuals who will be wearing masks within our community. The tagline of Do Your Part, ORL.com, or Do Your Part, ORL.com. And so the last thing I would tell you that today began early voting here within Orange County. So I'm proudly wearing my early voting sticker because I voted today. Some of you may have already done that through vote by mail. So we encourage all of our electorate to get involved in the voting process. The people who you elect, it matters to the decisions that we make within this community. And with that, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings. Mayor Demings is right. Fight against COVID has been a long one already. It's already August. We started in February. And while we're tired of fighting the virus, our work isn't done. It has to continue. But it's important to remember why we're fighting this virus. It's pretty simple. We're fighting it to reduce the spread among our families, our friends, our neighbors, our first responders, our frontline workers, ourselves, every single person in the city. And our transportation partners are doing their part. Orlando International Airport has taken a lot of steps to ensure the safety and the health of residents and visitors. They've increased frequency of their cleanings. They put up signage reminding travelers of physical distancing protocols. They have face covering policies that were adopted by the board in July. By implementing those additional safety and cleaning protocols, they have been able to slowly but safely build their traffic back. They've got a long way to go. As part of our new normal, Lynx has also implemented additional safety and cleaning protocols. They continue to require face coverings for riders and drivers and have various stops are handing out face masks. They have hand sanitizers on all of the buses, and they have, by the end of August, they'll have driver protection shields installed on every single bus. In addition to those changes, they remain fareless through the end of August. This past weekend, as the mayor said, I'm not even going to try to pronounce the name of the storm, but we were fortunate that it stayed off the coast. But it's a good reminder that in addition to doing the things that you need to do for the pandemic, you need to be prepared during hurricane season. So get your family and business safety plans together. Make sure you have everything that you need if your power goes out or you have to stay in your house for several days. You can check out the resources to get for your family and business by visiting orlando.gov/I'm ready. So we continue testing this week, and we will be at Camping World Stadium on Wednesday, August the 5th from 9 to 1. Dr. Pina.
Thank you, Mayor. Good afternoon. As Mayor Demings mentioned, we in the county has over time 29,927 cases for an 11.6% positivity rate. And a recovery rate right now, it is 87%, has greatly increased. And we have a total of 239 deaths. And I know we say it every time, but I want the families to know that we really are with you guys, and our thoughts and prayers are with you. Since our last time here, we have identified 20 additional deaths, and those range from 53 to 94, 11 females, 9 males, 3 Asian, 5 black, 2 other, 8 white, 2 of unknown race. With regard to ethnicity, 4 Hispanic, 7 non-Hispanic, and 9 that we don't know yet. 16 of those had pre-existing condition. 1 person did not report any pre-existing condition, and 3 individuals, we don't have the information as yet. With regard to long-term care facilities, that's our next battle as I see it. We have in total today, as of yesterday, I was second, 360 positive people in assisted living facilities. Those are, I'm going to give you the ones that we have new cases to you last time. And those are Rio Pinar, with 6 new positive staff and 17 new positive residents. Orlando Health and Rehab, And this is a facility that we have to be mindful that has been designed and designated as a recovery facility for some of the people that are getting discharged. So there, naturally, the numbers are going to be always going up because that's a place where we discharge people in for some locations. But staff, 32 positive, new positive since we talked last, and 11 residents. For Colonial Lakes, a new staff positive, 3 new residents positive. Conwell Lakes, 5 new staff, and 7 residents. So those are the numbers of the facilities that have new cases since we talked to you last. We also, I want to call your attention that yesterday we received, as the measure mentioned, 340 positive tests. Out of, also we received 3,080 negative tests, and that gives us a 6.8% positivity rate. It's really a drop from Friday, which was 8.1. So the obvious question is, did the weekend has any effect on the positivity rate? And the truth is, yes, it should have, although we think there are other factors there, because also on 7/25, that was not a weekend, we hit it at 7.9%, or not a weekend without interruption of testing. Also, I want to highlight to you some indicators that continue to go down. ER visits for flu-like and for influenza-like syndromes has tremendously decreased, which is a good news. And also, in the last 5 weeks, we have reduced the incident rate of COVID-19 new cases per 100,000 from 360 to 160 last week. And with regard to the total number of cases, on week 31, that was last week that we finished, we had a reduction of a negative growth of 35% with respect to the prior week, which had a negative growth of 29% with regard to the prior week. And this is the graph that I follow the most. This is rolling average positivity rate for the last 14 days. And in that graph, we don't count any test done at Disney for the MLA of the NBA. The idea is to, although those tests are done in our county and they should count and they count, I also want to take a look at our residents itself and not everyone else. And this gives us the ability to do that. And if you can see, our positivity rate continued to decline. At the highest point was about 20-something%, more than 14 days ago, and right now it is at 11.5% positivity rate, rolling average last 14 days. Next slide, please. And here is the positivity rate each of the last 4 weeks in the last 4 months. Hospitalization next. So this is another place that we are starting to see gains, statistically speaking. We have a reduction in the number of hospitalizations, which yesterday at 5 p.m. was 357, even lower than what is in there. ICU cases last night were 85 in the county. With regard to hospital systems, the hospital continued to report a healthy inventory of beds. We have, as of yesterday, 1,058 beds available, and we have 85 ICU beds, 85 people in ICU with COVID-19 and 357 in other facilities in the hospitals. And our positivity rate, and I told you already, our residents in long-term care facilities with COVID-19 is 360. With that, I pass it back to Mayor Demings and will answer any questions that you may have. Thank you.
Okay, are there any questions? And remember, the Spanish-speaking media, if you have any questions, we'll try to respond to them during the presser. If it's for me, I'll ask Ms. Ilia Torres to come forward and help translate for me. We also have County Commissioner Maribel Gomez Cordero here, and then Dr. Pino is fluent in Spanish as well.
Lauren Seabrook, Channel 9. Mayor, my question's for Dr. Pino.
Dr. Pino.
Dr. Pino, I asked you about this last week, and of course over the weekend I started to see yesterday and today some excitement on social media from people who think that our numbers, are way down, and they show to be way down. But can you just talk a little bit more about maybe how your staff is interpreting these numbers, because they are thinking about the fact that so many testing sites were down, but with the decrease in some of the hospitalizations, we're starting to see the deaths tick down a little bit. How is your staff interpreting what they see right now?
So we are in a very good position. The county is right now, and we should try not to do anything that would jeopardize that. It have taken us, remember the mayor ordered the masking of the county on June 20th. And here we are 6 weeks after, and now is that we start seeing solid results. We saw immediate results the week after, but solely statistical results is what we have right now. And the county is in a very good position to continue to decrease these even below 5%, which is what I'm striving for. Because the importance of reducing these numbers is not only the fatality that obviously is a big concern for us, and especially now with the large number of people in assisted living facilities with positive results. Although most of those are asymptomatic, it is critically important that we protect them. But also, it gives us the ability to do our work when we have a low volume, because it gives us the ability to be able to effectively do trace investigation and spread the virus, stop the spreading of the virus in our community.
This is Steve Hudak from the Sentinel. I have a question for the mayor, Mayor Demings. I know you mentioned that the eviction diversion program, the details were being worked out. In general, can you say how it would work without getting like the details?
Yeah, some of the details are not just ready at this time, but the goal is to create the opportunity for residents who may not be able to pay current or past rent payments to have the ability to pay either all or a portion of that, depending upon where they are. And we will use CARES Act dollars to assist our residents, Orange County residents, with that, and hopefully avert the potential that the filing of the eviction would occur. So we want to divert that. So it will require us to work very closely with the courts, with the Orange County Bar Association, Legal Aid Society, with landlords or apartment managers, et cetera. And for the most part, what we're talking about would be individuals who have been impacted by the pandemic.
Hi, it's Samantha Sosa from Fox 35. My question's for Dr. Pino. Dr. Pino, can you clarify and talk a little bit about the lapse in time between when an individual is tested and when we see those numbers? For instance, these numbers that we're seeing right now, when were those tests actually taken?
Well, I didn't look at the data specifically. That can be, that can be easily established. I just have to ask our EPIs to do it. Most tests are coming closer and closer to 5 days right now. But we continue to see some outliers. But for the most part, it's going back to a very regular schedule, better than it was before 10 days, and even more in some cases. These are probably, if you want the data about when the dates were done for the labs yesterday, we can get you that. But I will assume, so we tested some of our employees on Friday, and we received the results on Sunday. So it's going better than was before. But it will be neglectful of me to say, this day, because I haven't looked at it. But we did maybe 50 of our employees on Friday. We got the results on Sunday. Mm-hmm.
Dr. Pino, this is Jeff Allen with Spectrum News 13. We've seen a significant decrease in the death numbers in the last few days. Last week, we were breaking records statewide, and I think that's been reflected in the local numbers. Do you think that that's an clear indication of an improvement overall, or do you think maybe the lack of reporting of the last few days, many of these agencies that report deaths, we're getting ready for a major storm, do you think that may factor in, or do you think it's just we're just seeing that kind of an improvement?
No, I think there is a real improvement. We should be careful in the sense that with that many people positive in assisted living facilities, we run the risk of seeing, if we are not careful enough, an increase of the number of deaths, even without having an increase of the number of hospitalizations proportionally. Because most people who are in assisted living facilities meet the criteria for high risk with regard to COVID-19. So that's why the state decided that even one case in an assisted living facility, even if the person is asymptomatic, we will treat it as it was an outbreak, so that we put all the force that we can behind. Some of those efforts has paid off. We haven't seen any dramatic, and we don't want to, of the things that had happened in other places. And that would be tragic. But yes, the number of deaths has started to decrease, and that's the last indicator always to start going in the right direction. So we expect that to continue if we can control and protect the people who are in assisted living facilities.
Mayor Demings, Eric Levy here from News 13. I wonder if you can just expand a little bit on the strike team activity and how many businesses, I think it was several hundred, I guess, visited so far, and if there have been any kind of complaints, and where any of the businesses have been located, and if there have been any, concerns on any violation. Have any of the rules been violated?
By midday, we have visited approximately 400 different businesses, and they were located throughout the county, diverse types of businesses, from theme parks to retail outlets to grocery stores, et cetera. And the last numbers I heard, we were somewhere around 77% compliance rate. What we find in most regards are businesses whose signage regarding social distancing, regarding the wearing and requirement of wearing masks may not have been followed. And the compliance teams do take some collateral material with them, and they also share with the businesses how they can download collateral material that could help with the posting of the businesses appropriately. We are also taking personal protective equipment with us when we visit the locations. So if a business does not have an adequate supply of mask or hand sanitizer, they are leaving some of that behind as well. So it's a proactive venture that we have engaged in. And in terms of other specifics, is Tim Boldig here today? Tim's not here, so I can't get into, because I haven't personally gone to the inspections, but I get a report at least once a day on it. Still in the ballpark, 77% or so, but it is slightly lower. And so we are increasing our numbers, and we're going to continue to do this. So we're not going to give up at this point.
Hi there, this is Nikki Zizazo with News 6. My question is for Dr. Pino. Dr. Pino, you mentioned that at this point, since the order went in on June 20th, now you're starting to see these, the solid trend of numbers so that you guys can pretty much look into that. Many people are wondering when the end will be in sight. At what rate does the positivity rate have to be when you would recommend it's probably safe to lift the executive order with everyone wearing masks?
So if the mayor were to ask me, and he has not, when to lift the executive order, I would say after we have a vaccine. To be honest with you, that would be my recommendation. Of course, there are going to be other factors that have to be taken in consideration. My recommendation is not it. But even when we have a vaccine, so that people are clear, even if we get a vaccine December, January, it's going to take us a few months to vaccinate. First, we have to be hopeful that people are going to get vaccinated. That's the first. Are people going to be receptive to the vaccine? That's the first question. And the second is, I'm pretty sure there's some kind of priority would happen, probably for, assisted living facility, healthcare workers, first responders, people experiencing homelessness, maybe students and schools and that type of environment first. And it will take us 4 or 5 months to get people vaccinated to a level that you can say, okay, now we are getting immunity to a level that we can start relaxing those protective measures that we have in place. But people should not look at anything of these ending before the spring fully with a vaccine in place by the beginning of the year or the end of the year. It will take us a few 4 months, 3 months to vaccinate. We have 1.3, 1.4 million people in our county. So it's a large number to vaccinate and to get to those levels.
Dr. Pino, this next question was texted in from Danielle Lama with Fox 35. It's on that same trend of vaccines. Can you ask Dr. Pino for his take on the discussion over who will be able to access the vaccine first when it is ready? What groups of people does he anticipate will be vaccinated right away?
So I just talked a little bit about that. I really don't know. The CDC advisory on immunization will make those recommendations to the CDC. Normally, it should be the people that are higher risk to acquire the disease first or to have a poor outcome. That's normally how they go about vaccinations. Now, this one is a little bit different, but I suspect that people in assisted living facilities, people experiencing homelessness, first responders, and healthcare workers will have some level of priority.
This next one is for you as well, Dr. Pino, from Eric Mock with News 13. What exactly are the impacts you're foreseeing from testing centers being closed over the weekend? Will there be a lag in getting results? And do you feel there could be another surge because those who are asymptomatic may not know it and continue to spread the virus?
So the numbers didn't, we were reporting a little bit over 4,000, sometimes 6 or 7, but those were extreme days. Our numbers are, even with the places closed, we got a hovering of about, 3,000 cases. Now, remember that test results are delayed. So we may not see a real delay until maybe tomorrow or Wednesday from the results those places. So if we see a decrease of the number of tests that we received today and tomorrow, then we will say, okay, yes, it had a real impact.
Dr. Pino comes from Natasha Chen from CNN. She wanted to check in and to see if there are any data trends or anything showing any changes in regards to cases stemming from area theme parks.
No, and we continue to look forward. We are in constant communication with the parks. I'm not saying that transmission has not happened at any given park. We have community-wide distribution, so you're safe to assume that transmission is happening everywhere in the county. But what I can say with confidence is that we haven't been able to establish an outbreak in any of the parks.
Thank you. And this last question was texted for you, Mayor Demings, from Ryan Lynch with the Orlando Business Journal. In regards to the eviction diversion program, Mayor Demings, if possible, is that same program going to apply to small businesses at all?
I don't know all of the details yet. We're still having a conversation, but more than likely, this will be for individuals and families. Okay. Are there any other questions? Right, I don't see any. So thank you all for joining us today. Certainly if there are any questions for one-on-ones, different members of our staff are available for that. All right.